So I am Stephanie Curenton. I'm a researcher from Boston University, and I am the executive director of a research center there called the Center on the Ecology of Early Development. And at our center, our focus is on conducting research, applied developmental research that looks at the ways that Black children can grow and thrive, and disseminating that research to policymakers and practitioners.
Good morning, everyone. I'm Leslee Barnes. I'm the director of the Preschool and Early Learning Division in Multnomah County, which is in Portland, Oregon. And so we actually started, I'm the first division director at the county that focuses on early learning. And so our task is to implement a universal preschool measure with an equity focus. And so we're looking at the experiences of Black and Brown children, make sure they have access first, the first folks that are the marginalized community get access to that universal preschool measure in our early years.
Okay, and so this is a brief outline of our presentation. I want to talk just a minute about how we define our research practice partnership. Then I'll turn it over to my colleague who will describe Preschool for All, which we call PFA. And then I'll talk about some of our work, our research work to date. So I am by training a developmental and a community psychologist. And so the idea of a research practice partnership is the kind of research that I'm very heavily emotionally attached to, and my values, and they're very heavily laden with my values. So in this partnership that we have here, we think about and define our research practice partnership as a collaborative, long-term relationship between researchers and practitioners, and with the goal of being designed to improve educational practices, or in this case, too, educational practices as well as service delivery of a program. It's really important to have this point of view because community-based research or research practice partnerships are really integral to using that research to inform decision-making, or helping our partners use that research to inform decision-making. And it's also really important because this type of research partnership maintains a focus on things that have real-world implications and real-world practices, because sometimes researchers can get stuck in their little lab view of the world and start to ask questions about things that really have nothing to do with the price of rice. And so if you are engaged in a community research practice partnership, then you are constantly being grounded around that work.
Okay, and so I'm going to take this next section to really talk about, let me go to the next slide, if you don't mind. Thank you. Of course, my battery is running low. Look at that. So I just want to kind of ground us in how we came up with Preschool for All in Multnomah County. And so it was with work that started about 10 years ago with some philanthropy, our early learning hub, which is housed at United Way. And so we had strong partnerships with culturally specific organizations, our Child Care Resource and Referral, Head Start, large childcare chains, all in order to design a system that would work for families and children, which would be a mixed delivery system. And we ended up having a champion of our county commissioner at the time, who's now chair of the county, to really help move this work forward. And having a strong parent voice at the table for its entirety was essential to the success. So our Parent Accountability Council at United Way had 12 parents from 6 culturally specific organizations that played really a central role in the development of Preschool for All and what our aims and goals would be. And they're really continuing closely aligned and really making sure we're staying on track with those initial efforts. And so they actually designed all the recommendations. We had over 100 people really working on this. And so from the beginning, even before Preschool for All existed, there's a commitment to racial equity and the idea that we needed to do better for the children and our families in our county, especially those furthest from this preschool opportunity. family. So that ballot measure passed in 2020, right in the midst of the pandemic. I was kind of surprised because of where the world was at the time. We had overwhelming support of voters. And so that's why my position in the division at the county level was created. And so we are working on creating supports and structures that will create a universal preschool access program by 2030. You can move to the next slide. So really that idea that families should have access and opportunities to the preschool that meets their needs. So mixed delivery for us includes family, child care, center-based care, Head Start partnerships, slots in schools, charter schools. So wherever a family sees and wants a preschool opportunity, they can find it there. And so we're building that future for families and that they will have access to culturally responsive and inclusive preschool. And so one of the things that we are committed to is not having childcare children in preschool be expelled. And so with that commitment, we know that Black and Brown children are they're disproportionately in that space of being asked to leave, either soft expulsion, going home early, you're not a good fit, those kinds of things. And so we really want to disrupt what we call the preschool to prison pipeline. And so while we're building that system of ECC providers, we're also thinking about how this impacts them. Do they have a livable wage? One of our goals is to make sure they make on par to kindergarten teachers in our school district system. So we're partnering with them to really think about how are we impacting childcare and preschool in our communities. Because we have a universal preschool initiative, we could actually disrupt and close these small businesses are typically founded and run by Black and Brown providers in our community. And so we're wanting to make sure there's no wrong door for families and that if they want family childcare, they'll get the same kind of services and supports they would get if they were in a school district building or a Head Start. And so one of the things I wanted to highlight as we're thinking about equity is we're really focusing on family child care. And a lot of times in systems, they're left out of publicly funded preschool programs, either explicitly by the barriers put in place or just people think that family child care is not high quality. We know a lot of our Black women and men want someone that looks like them, and that might be the lady around the corner. And so we want to support her to also be able to provide that high quality service. And so we can go to the next slide. Okay, so this is just a snapshot of our enrolled children. So as you can see, we have children that 22% have a developmental delay or disability, are from families with low incomes, live with a foster parent or legal guardian, or experiencing homelessness. And so as we're talking about children that are experiencing trauma, and as we're inviting them to these unique and diverse preschool programs, we're saying you take the children we send you and we're going to support you to do that. So there's not a, you're not a good fit, or I don't have experience with that behavior. We're going to connect you to the resources so that that child does not experience a failure in their first early years of life. And so those first children enrolled, we started out with 700 children. The next year that doubled to 1,400. This year we're looking at over 2,000 children enrolled. And then we're thinking about, as we're designing this, how do we know we're doing a good job? We're not researchers, we're funders, we're building a system. And really, I wanted to back up a little bit and talk about how we met, because she's actually on the East Coast and I'm on the West. And so as we were thinking about the ways to assess programs, we thought about Eckers environmental, like rating, class, but there wasn't anything really that really kind of could help people think about their bias and what might be becoming a barrier to that relationship and welcoming all families. And so, you know, someone on our team was really, Brooke Timmons reached out and found Stephanie online. And so even before I became the director, she said, I heard about this tool. There's this amazing research entity in Boston. And I was like, yes, ma'am. Yes, ma'am. We want that. We want that. And so that's how that partnership began, because we know we have blind spots. We're not researchers, right? We need a strong evaluation. See, are we really supporting racial equity? Are we really having joyous opportunities for Black and Brown children? Because we know if we get that right, it'll be good for everyone else. This is a universal preschool measure. So that means everyone by the year 2030 will have free preschool that wants it, regardless of income. So we're really trying to start with the children furthest from the opportunity first, not just the funding, not just the support for the providers, but what is really happening with that child in that space, right? What is happening with that family so that they are ready for preschool and it's not ready for kindergarten, not just I can write or recognize my name, but I feel affirmed as who I am. The family feels affirmed in who they are. And so we hand them off to K-12 with the hopes that that will continue for them. We can go to the next one. My laptop went dead. Okay, so this is just another snapshot of who we're serving. We have a very diverse population, and we're really wanting to make sure we have providers that can support the children, that look like the children as well. And so this just gives you an idea of who those folks are. And so we're developing supports for the children, and we can go to the next one, actually. I want to talk about the providers because we talked about a mixed delivery system, and this just shows who's participating. Now, you see a large number in the family child care setting, but of course they serve a smaller amount of children because their license capacity, right, is lower than the other folks. But when we see that, we have to design supports that they're successful. So we're actually supporting them around business acumen. What are your policies? What is your, not just what your curriculum is, but how are you inviting families? Like if you're a family child care provider, a small center, and this is your business, you're like, what do you mean families are gonna have to say so in this is my business. And so we have to have them understand what that really means to invite and welcome families. And so we are talking about, we pay them the same as we would the school district slot and reimbursements are the same. We have an inclusive team that actually, if a child is experiencing some developmental delays, if they have some behaviors, every site has an inclusion coordinator to support them in that. And so that's really a snapshot of the kinds of supports we're building so that we can figure out, okay, we did all the things, but how do we know it's really working? And that's kind of really what the partnership is about. And we talked a little bit about this, but I know we're running low on time. So I'm gonna, this is just a lot of the supports that we talked about. One of the things I do wanna highlight is infant toddler stabilization is also a part of our work because we know when you start implementing publicly funded preschool, a lot of people say, they're paying more. I'm going over there. Forget those infants and toddlers. And infant toddler care is already hard to find. So we incentivize folks that are doing that work and also so they can pay on par with our preschool teachers so that those teachers don't say, I want to make more money. I'm not going to do this anymore. And we're further disrupting the system by allowing that to occur.
Okay, so I'm going to tell you a little bit about some of the stuff that we have found. I've already told you a little bit about seed. We can talk about that a little bit more. I want to talk to you a little bit more about that, our initial relationship and how we got started and why that's so important. So as she said, one of her staff members actually had attended a session or something that I had done, and she cold emailed me saying, I'm from Multnomah County and we're starting a universal preschool program and we want it to be focused on equity. Will you talk to me? And so I'm an early childhood person through and through. So I've taught in Head Start programs. I attended, early childhood programs. All my research is in this space. So I'm willing to talk to anybody about young children and the services that they need. So I responded. And through these conversations, we went back and forth about like 3 or so Zoom calls about the work that they were going to do. And what kept coming up in those conversations was this focus on equity, this rootedness in equity as they were rolling out this universal program. In the early childhood field, we have never had a universal preschool program that explicitly put equity as one of its missions in the statement and been so explicit about it. And so I thought, this is a different kind of place, right? This is a different kind of program, and I would love to be involved with that. And so some of the things that we've done throughout this partnership, I'll just tell you briefly, is that because it is a long-term partnership. We've really taken this implementation science approach, which means that we have committed ourselves to sort of looking at, in terms of the research process, looking at sort of how this program exists in the real world and constantly being in a feedback loop with the designers, the practitioners and the policymakers, as well as the community that is being served. And this tool that it's called the Assessing Classroom Social Cultural Equity Scale. This is the reason why Brooke reached out to me. This is the reason why she found me, because in our early childhood community, there are just some of the what is considered to be the standards of how we know and assess what is good quality in early childhood programs. But those measures don't center equity. They're not rooted in the development of racially marginalized children and linguistically marginalized children and their growth and development. So this measure is, and that is what led Brooke to me, because what they're saying is that when we want to evaluate whether or not our program is working, we want to make sure that we understand that it is working from an equity standpoint, that the equity is still rooted in its mission. So I think that we have to go now. I can't say anything else. Okay. So sorry.
We will
So-
have time for questions, though.
Okay,
We
okay,
will.
thank you.
You want us to put it?
Where you feel most. Thank you so much for that wonderful example of a beautiful community partnership with with a university as well, and the work that you are doing with that assessment. So now what we are going to do is go to our next presentation which is with Dr. Keon Berry. I believe that you are the youngest African-American male to receive your PhD, is that correct? Yes, so really excited to hear from you.
Thank you. Okay. There we go. All right, so it's so good to see everyone. I just want to start off, praise the Lord, everybody. How do I follow that? Wow, that was so good. Can we give them another round of applause? That's fantastic. So it's so good to see you all today. My name is Dr. Keon N. Berry. I like to say my entire name because to take away from one's name is to take away from one's power. But I'm going to go ahead and just get started. These are my stopping grounds. Welcome to the house, y'all. This is Morehouse College. Okay, so a little bit about myself. I'm currently the Director of Parent Services at Quality Care for Children. I'm a professor of sociology here at Morehouse College. I'm the youngest faculty member and the first Gen Z faculty member here at Morehouse. And I'm also a board member of the Black Child Development Institute here in Atlanta. And recently I started my own consulting firm called the Dr. Keon N. Berry Group. So as I engage in this conversation with you all, I always like to give a trigger warning, for lack of better words, particularly when we talk about things that are related to race, because that can be triggering. We know that there's a lot of racial trauma surrounding education and who has access to it. So just some things to think about as we engage, active listening, using I statements, respectful tone and language, challenging ideas and not individuals, and establishing confidentiality within this brave space. Okay, so moving along, why is early childhood education important? And I absolutely love this question. Just a little bit about me. My mom is actually a preschool franchise owner in Connecticut. And so I grew up in my family business, which was a preschool, which eventually transitioned over to a facility. But I want to talk a little bit about the importance of quality early childhood education, because we know that 90% of a child's brain is hardwired before the age of 5. And so early childhood education is often viewed as an investment, or should be viewed as an investment and not a cost. Oftentimes when we talk about education, right, we often look at the price tag on it, right? Like, how much is that tuition, right? But if we were to ask someone, how much is that perfume or Rolex? Oh, excuse me, never mind. So we have to continue to look at early childhood as an investment because there's so much stake in those early years, particularly for children who are ages 0 to 5. And we know that their life trajectory really depends on those early years. You know, through mirroring and other methodology, they learn how, what it means to be human and how to function as a human. Particularly for children of color, they learn how to be Black children, right? And so it's very important for us to note the advantages of quality early childhood education. So moving along, when we talk about the money, right, we all know that the money matters, and it certainly does, right? And so just to bring this to your attention, for every $1 that we invest in early childhood education, the return is multiplied by 8. So oftentimes when we're having these conversations with various folks about what early childhood is all about and the impacts of it and the outcomes of it, there's always this conversation about the cost, right? But research has shown us time and time again that when we invest in early childhood education, that the impact of our investment is multiplied. Moving along, so I wrote a 140-page study, and this study encapsulated the experiences of Black low-income parents and what was their experience accessing quality early childhood programs. And this is very important because we know that African-American families have unique challenges with accessing early childhood. That with the intersection of income really adds an even bigger impact to the table because we know that race matters, but that with the additional intersection of income magnifies the situation in general. So this study just seek to explore, well, what are Black low-income parents in Georgia saying about childcare? And what I've done in my research is use it as a tool to tell stories about Black families. So moving along, what are some of the unique challenges that Black low-income parents face that those who don't identify within those categories might not necessarily experience in a similar way? So just looking at what the literature says, the literature points out 3 specific things. The first thing is with systemic racism and discrimination. The second thing is with income level and earnings. And then the last thing is with quality ECE programs. And since this was last published, I like to often use the word high quality early childhood education programs because those of us who are in the field know there's a tremendous difference between the goods, the greats, and the phenomenals. And so the literature is very clear that these 3 areas that are listed here point to the explanation for what are the actual barriers or challenges that Black low-income parents in Georgia face. Moving along, so here were some of my research questions, and I think that you should always research the researcher and ask as many questions as possible. And so the 3 main questions that guided my research were, what are the lived experience of Black low-income parents' access to quality ECE programs? The second question was, what are Black low-income parents' belief about the role that their race has played in their access to quality early childhood education programs? And the last question, what are Black low-income parents' belief about the role that their income level has played in their access to quality ECE programs? So this study is so significant because we want to inform those with the positional power to advocate for Black low-income parents. As I stated, they do have unique challenges. And with that being said, we have to often ask ourselves how we can take a family-centered approach that is holistic to make sure that we meet parents where they are. And, in our educational system, there was a point where it was very teacher-centered or staff-centered. But as we move into the 21st century, you will find the significance of educational institutions meeting families where they are. All right, so methods, and I completely changed this slide because I had a whole bunch of fancy scientific language, but just to keep it very simple, this is my process when I am trying to explore these phenomena. So I like to use recruitment and purposeful sampling, which means that I am intentional about the parents that I select. This particular study had 8 parents, 4 dads and 4 moms, just to make sure things were balanced. I like to use, as I stated before, narrative inquiry approach. So once we record on Zoom, I'm able to pull that transcript and write a story from our conversation. Following that, to protect the identity of the participants, I use pseudonyms to make sure that their identities are protected. To use is key themes to make sure that whatever comes up in the research can be identified. Okay, so moving along. So some of the primary things that came up were for income and race were very different. So let me start with income. So regarding income, one of the biggest, the 4 themes that came up as reported by Black low-income parents in Georgia was financial barriers and affordability, limited availability in subsidies and scholarships, which still is affordability in a sense, but a little different, impact on program selection and overall quality, and disparities in program access by neighborhood location. And one thing I just want to point out regarding that, we know that our rural areas are often overlooked. I know some of our friends from Valdosta are here, some of our friends from Columbus are here. When it comes to early childhood, we have to level the playing field in terms of location. And the research is abundantly clear about that. Following that, race, some themes that came up. Racial disparities in program availability, implicit bias and stereotyping, financial barriers and affordability, culturally responsive and inclusive practices, and parent inclusion and belonging. Okay, moving along, let's look at these income findings. So one thing I want to share, these quotes are actual quotes from parents who I interviewed. And I think that the information is very telling. So financial barriers and affordability, I'll allow you guys to read the quotes, but many parents are saying childcare is not affordable. And if we look at the research, not only is it not affordable for low-income parents, it's the cost of a college tuition. It's expensive for everyone, right? And so a lot of Black low-income parents shed light on their thoughts regarding affordability. Limited access to subsidies and scholarships. One of the problems is not only is there limited access, sometimes that access or the scholarship in general is not as flexible, right? And so, they might be a few dollars off from, being able to qualify for the public subsidy that would allow them to pay for it. And that makes it increasingly difficult for parents. Impact on program selection and overall quality. Some parents said, I'm not even looking for quality now. I don't know if I can find that, right? And so just being aware that Black low-income parents are saying they're having a hard time finding quality centers. Next, we have disparities in program access by neighborhood location. We know that some areas in the state of Georgia get more attention than others. So particularly for some of the participants in this study who lived in more rural areas, there were some issues there. One thing I do want to raise, as raised by Abani, she said this situation would have probably been different if we were in a more affluent area like Buckhead. For those of you who are not from Atlanta, we know that Buckhead is, a completely different side of town than Bankhead, right? And so Amani made it very clear that areas that might be more suburban might be more advantaged. Moving along to race. Racial disparities in program availability. Black low-income parents are saying that they feel like their race is a barrier in accessing quality programs. Culturally responsive practices and culturally responsive and inclusive practices. One thing that a lot of fathers shared was the need for father-friendly spaces. Oftentimes when we look at early childhood education, fathers are often stereotyped. Black men are often stereotyped, right? And so culturally responsive practices and inclusive practices don't just encompass including fathers, it encompasses including Black children and their whole families. And then financial barriers and affordability, again, just knowing that, childcare is expensive, particularly for Black low-income people. Implicit bias and stereotyping, This is pretty much self-explanatory. This was a key theme that came up in almost all the interviews, with parents saying that there's a lot of inequalities and disparities with how they're being treated versus how other people are being treated. And then lastly, parent inclusion and belonging, fostering an environment where Black low-income parents feel safe enough to contribute to their child's education in the way in which the school would want them to, right? And so that goes back to being parent-centered educational institutions. Okay, so implications for policy and practice. I'm sure based off all the different things I shared, you could probably imagine what the different implications are for policy and practice, but I think the research is very clear. Okay, it is not the gap in educational achievement we need to focus on. It is the preparedness for education in the safe, inclusive, and equitable environment filled with belonging to learn and achieve, which results in a quality education. Thank you all so much.
Thank you, Dr. Keon Berry. Such insightful information that the parents shared with you. Thank you so much for sharing. And now we will have our last presentation of this session. We have Drs. Allison Stevens and Dr. Daryl Armstrong coming to us, focusing on infusing child development science into the ministry activities of clergy in predominantly Black congregations. You may come at this time.
We'll just go ahead and get started. So I'm Allison Stevens, and I am from Tufts Medical Center, Tufts University School of Medicine, and I work for the Hope National Resource Center as the Director of Networks and Policy. And just to really quickly clarify, so when we refer to networks, really talking about our external relationships. So how we network with the community, how we engage and and including our professional collaborators, of which Reverend Armstrong is one of them.
Give a shout out to Reverend Dr. Keon Berry over there. So Pastor Armstrong, I've been pastoring the Shiloh Baptist Church in Trenton, New Jersey for the last 24 years. It's Trenton's first Black Baptist church founded in 1880. And so we have 144 years of religious and social capital that we've been able to build. And our partnership, similar to what has already been expressed, research to practice, I've tried to take what we know in our religious and ecclesiastical spaces and then fuse that with research and evidence-based work so that our families and our communities, on one hand, our clergy are not scared of evidence-based research, and that the researchers are not afraid of religious leaders. And for the best outcomes for children and families, that we figure out how to fuse the religious and the social and the academic in forming these practices. I'm a former director of New Jersey's Division of Child Abuse Prevention, which was a $100 million organ, state government, that looked at all of the upstream prevention programming. So home visiting was under my watch, family support centers were under my watch, school-based youth services program were under my watch. And so I left that position while still pastoring, trying to figure out, God, why did you give me this opportunity? And God was real clear, fuse it together, right? And figure out how to make it palatable for our families and our community.
So one of the things that we have done is come together to figure out a way to do a more formalized version of some of that fusion that Reverend Armstrong has created. And so I mentioned that I am from the Hope National Resource Center. So in this context, HOPE is an acronym for Healthy Outcomes from Positive Experiences. And Reverend Armstrong had begun to start integrating our framework of hope, which is related to the impact of positive childhood experiences as opposed to adverse experiences on lifelong health outcomes into his ministries, particularly those related to baby blessings. And so we thought it would be an amazing opportunity for us to come together to take what he pioneered in fusing that research in with ministries to support families, and I don't want to misquote you, caring for the blessing that God has given them.
You got it.
There we go. And try to formalize that in a way where we're bringing that together in a way that can be disseminated across various faith traditions, but also in a way that can specifically address some of the challenges that members of his congregation would face. So I'll let you go ahead and start talking about the underlying concept about of the model.
So every year I bless at least 10 to 12 babies. And it used to be that I would say to the families or my secretary, my assistants, have them meet me on this day early, the day of the blessing. And they're going to sit in a certain place after this part of the service. They're going to come up and we're going to do this, right? All day of activities. And I was convicted by God, literally, to say, you are missing a window of opportunity to pour into these families knowledge and understanding about the early development of their baby's brain and what they should be doing to better care for their children. And so about 15 years ago, after I left state government, the Lord laid something on my heart called congregational home visiting, which is to take the best of what we know from McVie-funded programming. So all of what we know from Early Head Start, as was mentioned earlier, Parents as Teachers, Healthy Families America, Nurse Family Partnership. I had to interact with all of those folk in my state government position. And then how does that then get superimposed in a congregational setting? And so I said, instead of having, in addition to the external home visitors, we wanted to create home visitors from the congregation who would go into the homes because they have what? Trust. Whereas the external home visitors have to build that trust. So we already have that trust. And it's no different than what parish nursing models used to do in congregations. And then it became very clear that we already had been doing home visiting. We go home visiting when we do First Sunday Communion every Sunday, where we go into folks' homes to serve them communion. And so I said to our deacons and our servant leaders, we're going to start to implement a new model of family engagement where 10 to 12 weeks before the baby's blessings, we're going to have them do sessions on early care and education, baby brain development, right? 80% of the baby's brain is going to develop between birth and 5. Why is that so important? Safe sleep practices, all of the different things that we would want families to know in the early stages of life, prenatal and postnatal. And so we created this model, and what became clear also is that clergy of all faiths have some kind of baby engagement ritual, right? And so I may call it baby baptism, you may call it baby blessing, you may call it christening, you may call it dedication. What we know is that presidents and mayors kiss a lot of babies, but none of them bless babies. So we're the only profession in the world that has this sacred space of being able to take somebody's child and hold them up to the Creator and say, God, smile upon this child and bless their family. And so in that space, what do we do to be better stewards of that space? And so I'm on a goal to make every clergy, rabbi, priest, imam, sheikh, trauma-informed, resilience-minded, positive childhood experience focus, and not look at deficits, but look at the assets. Because scripture says children are a heritage from the Lord. The fruit of the womb is God's reward. The Bible says, Hannah said, God, give me a child. I'll give the child back over to you. The rubric of our baby blessing model. And then Moses' mama Jochebed said, God, I can no longer take care of my child. I'm going to send him down the river and trust that you keep him from the crocodiles and make sure and look at what God did. And so the baby blessing space is what we are hoping to do, infuse that with research and help make families stronger, particularly in Black and brown urban communities. I'll stop preaching.
So no, what I want to add to that is that we recognize from that research perspective that not only is it that part of the baby blessing, but it is the intergenerational impact that clergy have. It is the credibility within the community. So when we talk about those policy implications, when we talk about other things that need to happen at the system level, when we talk about engaging, think about all of those things, as you mentioned, Dr. Berry, with trauma, right? Those things that happen that can be passed on, the things that we need to teach families. What other institution in the community has that level of trust where if something traumatic happens, that is where our whole family turns.
Right.
And it can be that stable place to turn to for the grandmother. It would be that same pastor that they may go to for the grandchild and the great-grandchild, whether someone has passed away or whether you have a joyous occasion such as a wedding or a new baby. And so we recognize that while, and one of the things that we talked about when seeking grant funding was oftentimes in public health, we talk a lot about zip codes. We do a lot of programming around zip codes, but how many people, if you asked us, who are you or how do you identify, how many people are going to say, oh, for me, oh, I'm 2757. No, that's not what happens. We may say, as I've said, you know, I'm United Methodist, I'm a child of God, I am a part of a fraternity or sorority. That is how people identify, particularly people in Black and Brown communities. So this project was an opportunity for us to take the research that we have done and transition it in partnership with a group of people who have the power and the influence and the engagement across generations to have this type of impact. So Reverend Armstrong and I worked together to develop this model that I was so happy when you brought up implementation science earlier, because that has been the cornerstone of the work that we've done. It is okay for us to do research, but if we haven't engaged in that implementation science process, basically, how on earth is this going to work in the real world? And really understanding that was critical, because otherwise, no matter how many times Reverend Armstrong teaches families our framework, which we'll talk about for, I think we got like 30 seconds to talk about that, but we'll talk about the framework. No matter how many times he does that, no matter how much education we give, and this assumption that Black and Brown families don't already have some of this information that we don't know, it doesn't matter if when you go to access, you're encountering systemic racism. It doesn't matter if you know all of these things if you can't get to the child care center in your neighborhood. And so what we wanted to do was to take all of these various components, learn from what Reverend Armstrong was doing, and develop a comprehensive model as to, yes, we have the curricula for clergy and for them to use with the parents. But we also have an assessment here about the experiences of racism, how systemic racism plays out when people go to access the services and supports that they need. And we ended up developing something that was unique to this project, primarily because we found a need. There tended to be, you know, some language of, does racism exist? Or how do you feel or perceive? And we felt like that time was over. What we really need to know is, how is it playing out, so we can then get into that implementation science part down here, and we can then get into some of the system science guidance, which rounded out our model as to what do you do to affect systems once you have all of this information. So really quickly, I do want to just kind of give you an idea. We've kind of talked about some of the resources and content, but I also want you to have a bit of an understanding of the work that we do and why it is so tied in with religious teachings and why that came together. I so appreciate Dr. Berry bringing up the brain development issue in early childhood. And one of the things that we focus on is some research that is a little more recent than adverse childhood experiences and trauma, which many people are familiar with. But as you know, for me, as young and fly as I am, when I was a child, when someone had a stroke, that was it, right? Why? Because there wasn't really much that your brain could do. It was damaged. But now we kind of understand that there are things that the brain can do to actually rewire itself. Mm-hmm. So where you see on these scans, it might not be this part of the brain firing up when the person speaks. it could be this part of the brain, and maybe it's not exactly the way it was, but our brain does have the ability to rewire. And we found that that's the case also with literacy, and we found that that's the case also with post-traumatic growth. So how many of us in this space know somebody who just went through it as a child? Or how many of us were one of those people who just went through it as a child? But somehow, by the grace of God, on the other side, they're okay. They're successful. Well, what we did on the science side of this is we were able to identify that there's 4 types of positive childhood experiences that actually relate to the brain being able to rewire in that way to be able to help you to advance. And that means lifelong health. And we found that for things such as simple things like cigarette smoking goes down, or that you're less likely to have depression. And we're talking about as an adult. So when you think about it, oftentimes somebody will say, oh, it was a coach who took interest in me. It was my pastor who did that. We would call that relationships and perhaps civic engagement. And so you see where the synergy comes between us, because from a religious perspective, there has always been this concept of what we call neuroplasticity, your brain rewiring and changing. And from a religious perspective, it is that God can change people, that your past doesn't define who you are in the future, that there's always an opportunity, a brighter day is coming. And so that is where we saw this synergy, where we could find an opportunity to work together to develop this model, to expand the work that Reverend Armstrong had done, and help him to infuse this and also to live out that mission of bringing other clergy along to understand so that they could empower families with this information from a scientific perspective on what to do to support their blessing.
Let me just say something here, Allison. And so I'm a big believer that religion is still the queen of the sciences, right? An age-old thought that has been broken down in the Enlightenment. But for me, religion is still the queen of the sciences. And Maslow's hierarchy of needs starts with what we call enlightenment. I like to say spirituality, right? And own that space, because enlightenment is too fuzzy for me. I want folk to understand there's something incorporeal in them that drives them that's bigger than just their mind and their brain and their emotions. And so this notion of nomenclature matters in my space. And so I have been on a quest to translate the protective factors into language that my clergy brothers and sisters can better understand. So whereas one group, the social researchers, might say concrete supports in time of need, as a pastor, I may not get that. I may understand, I may not get it, but if you said benevolence, that makes sense to me, right? Same thing, different language. And so language matters in this space, which why I define myself as a cultural negotiator and mediator, being able to stand on one side in the academic space while I get my PhD from Fordham University in social work, but also stand in the other space, having gotten my Master of Divinity from Princeton Theological Seminary and served on its board, and understanding both spaces and trying to fuse those spaces together, because we miss people when we don't speak their language. And this is what we're doing, trying to speak each other's language.
So I know that there have been a few little issues with the timer here, so I don't want to, I'm good? Okay. So I just want to really quickly show you a couple of the resources, and then I want to also refer you to our website. So it is positiveexperience.org. Very simple to remember, but this is just one that I want to highlight for you quickly. So this is one of the resources that we have that a member of clergy would use when working with a family. And this is infusing into their existing ministries. So we're not saying replace. We give them tools on how do you add this in to emphasize the ministry that you're already doing. And we did have a parent advocate who worked with us in a local ministry that she was a part of for single mothers. And she actually tested some of these things, and she helped to develop some of these things. And so this is our Count Your Blessings worksheet. And this is how we address strengths. And so as you can see, it's those 4 building blocks that we talked about from the hope scientific perspective. But we're going to talk about things for emotional growth blessings, right? What are you good at? What is it that God's blessed you with the ability to do? And maybe that's a home cooked meal. It could be any number of things. It doesn't have to be something fancy, as we all know, but it does give that opportunity for a parent to connect with a child, or for a child to have access to the kinds of positive experiences that we know are going to benefit them like for the rest of their lives. And also, just want to let you know, we had a recent study done in Australia with Western Sydney University, where they found that you don't really even have to wait for the benefits of these things. You start seeing it by middle school. So the earlier you can give children access to these types of positive experiences, you already start seeing those benefits. And what we also know from the science is if you have experienced a trauma, it can mitigate those impacts. If you haven't experienced a trauma, it's still developmentally necessary. And it's also just good. And it's innate. It's what we do anyway, in a way. It's putting some structure around it, because oftentimes people, particularly Black and brown people, are told, well, the science doesn't support that. And so what we've been able to do with this is to help organizations around the country to have a framework to fall back on, to say, oh, God's already given me all the things that I need. And they can now take that, put it into a structure, and go seek funding. And that is what we've seen as the benefit to this, where organizations are able to say, oh, well, now we've gotten this from Tufts University, so we can call it something when we know that God has blessed us. And so that is what we've done. Again, it's positiveexperience.org, but really, I just want to take the opportunity to say thank you to Reverend Armstrong for having the vision to pioneer something like this, and for the willingness to work with us to take something that you had that was a word from God and help you to advance your ministry. So thank you.
Thank you so much for an amazing presentation, giving us an understanding of building partnerships with faith-based organizations. I know that earlier, Dr. Curenton, I wanted to give you a second to kind of finish up your points, because we do have a little time, and then we'll have some moments for Q&A. So did you want to come to the podium, or do you want to? Okay, perfect. So we'll start with you, and then we'll open it up for Q&A. And when Q&A gets started, you can feel free to come to the mic and ask any questions that you would like. Thank you.
Okay, thank you all for this. This is really important to us. I think some of the stuff, one of the lessons learned that we would love to share with this audience are sort of what are the strategies that we have been using in our partnership that really center equity. And one of the things that, well, we have a list of things, but the first thing that I want to talk about is how closely we work together. So working together in terms of protocol development, which is really sometimes unheard of when you think about traditional research, because traditional researchers come into communities with a survey, et cetera. They think that that survey already knows what the question should be, right? They're trying to apply sort of these other questions, these other ideas to a specific community. We didn't do that. We literally went through cycles and cycles of protocol development so that we could agree as a team in terms of what is it that we think are the important questions? What is it that they need to know in order to help their program run more efficiently? And what is it that we would want to know as researchers to help us then spread the word about children, how children grow and develop? I think another thing that has been really very important, a lesson that we learned, is the importance of communicating with non-academic audiences. Because again, coming into this space, if you're a traditional researcher, what you're trying to do is collect data so that you can write a paper, right? A research paper that's going to sit in a research journal, and there'll be like 6 people who read it, right? But we didn't want to do that. We really wanted to make sure that what we were learning from the community got back to the community and got back to their team. And so one example of something that I'm really proud of that the team has done is that we had an opportunity to conduct focus groups with parents. And if you all are, researchers, you all know that sometimes you have to kind of really entice people to come and participate in focus groups. And one of the things that we found, we were hoping that we might get maybe 40 people to participate in some focus groups, parents to participate in some focus groups. We got over 100 parents who wanted to come and talk about this program, who wanted to talk about their experiences with the program. And we learned so much as researchers, as well as, again, back to our partners about how the program was operating, what parents really needed, what was really important to the families, and we're about to do our focus group with providers, right? So we learned what families said about providers, and we could communicate that to them as well. And then the other thing that I would say that is important for us to think about too is that the program that Leslee and her colleagues designed is one, like I said, I greatly respect. I've been doing this work for over 20 years. And their program that they've designed is something that is new. It is novel in our field. And they have thought of all of the important policy levers in early childhood, and they have incorporated those things into the design. Things such as wages, things such as, like she said, the infant toddler slots, right, et cetera. And so this makes it such a rich program, and it's great, and I love it as a child advocate. It makes it hard as a researcher because we're trying to figure out, well, what exactly are we going to follow? What exactly are we're going to do? But I think that, that's a good problem to have. And I also think that it has opened our mind. The way the program is designed has opened our mind as researchers to really say that our question is not about a particular program. Our question is about how early childhood education can change a community, right? And so that's the way we're approaching sort of our implementation science. That's the way we are following up long-term the families, the providers, et cetera. And I just feel so grateful that Brooke found me one day and emailed me. And again, this is before Leslee was the director. And it was funny because Brooke kept saying to me in all these meetings, well, we're going to get this director. She kept saying this to me. And she's like, I think you're going to like her. Right. And sure enough, this came into being. And like I said, we have this great partnership and we have great team members too. Let's not forget, we have an amazing team on her side and the policy practice side, and on our side as researchers as well. And then the last thing I'll say is that the other thing that made this partnership a real success is that we were able to get funding to invest in this. So we had a great, very generous seed investment from the W.K. Kellogg Foundation that really supported this work. And they're still very much interested in supporting this work because they know how important it is and because it has that racial equity at the center. So those are the last things I'll say.
Yes, thank you, Dr. Curenton. That was a very important point to highlight the beauty of community-based participatory research and joining in with the community as equal partners to come up with solutions, but every part of that iterative process. So thank you so much for sharing. Thank you. So at this time, we will have Q&A. I will kick off the Q&A, but you can feel free to come here. And my question starts with Reverend Armstrong. Churches are such a wonderful place to partner, but a lot of researchers do not. And so what recommendations would you have for researchers who have the same interests in reaching families, reaching children, to partner with churches? How should they maybe translate their language? And what kind of heart posture should they have when they are contacting churches?
Love it. Love it. Great question. Heart posture. Is that what I heard you say? Love it. So as a budding researcher myself and as a long-term practitioner of faith, having grown up, born and raised in South Central Los Angeles, I've been a part of 4 churches in my life. So 18 years, Holy Light Missionary Baptist Church on the corner of 96 in Normandy, those who know LA. Been in East Palo Alto after I did my undergrad at Stanford, lived in East Palo Alto, and was a part of the St. John Missionary Baptist Church, came east, go to seminary at Princeton, joined the Union Baptist Church, and eventually the church I'm now pastoring, the Charlotte Baptist Church. And each of those 4 settings, geographic, representatives of what we face. Grew up in South Central, was bussed out and educated in the Valley. So saw 2 sides, right? Educated at Stanford, lived in East Palo Alto, 2 sides. Went to Princeton, lived in Trenton, 2 sides. There's always 2 sides to a community. And then not just limited to 2 sides, but multiple sides. And so I think in understanding, a researcher must always understand, particularly researchers that are not of our background and experience, need to understand what is that other side? What is the other side of experience like for that person? And they must always exhibit cultural humility. They must always enter a community that is not theirs, whether it's by race or geography or religion, with humility, understanding the historicity of exploitation and abuse. For reproductive science under Dr. Mims, it might be celebrated, but he abused enslaved Black women to get that research, right? We're standing in places, even in Atlanta, not too far in Tuskegee, and you can name all the other abusive medical research practices that inherently make Black and brown folk hesitant about researchers coming into their community. There is an inherent distrust of the research community / medical community when it comes to exploitation of our people. And so you must, as the researcher, and worse, if it's a melanated person who doesn't understand that history. And so it isn't just for warning of white folk and other African descendant folk. It's for all of us. Research means a history of exploitation, whether you like it or not, and you must always enter that space with that cultural humility. Having said that, right, then we need to help others on the other side, the ecclesiastical side, understand the possibility of transforming what was meant for evil into what God can use for good. And this is all about what all of us are talking about. A quick response that I always give folk who ask me this question. A lot of folk don't know where to start when it comes to denominational engagement, but here's an easy place for researchers to start. Find your local academic institution. I will guarantee you most every academic institution has a university chaplain. And guess what? Those university chaplains are great mediators between the houses of worship and the community, South Central, East Palo Alto, Trenton, but the research institution might be based in Princeton and Stanford at UCLA. But that chaplain's job is to figure out how to be a mediator between the institution, the town, and the gown. Another place to get good religious entry points are chaplaincies in hospitals. Their institutional presence, right, is also guaranteeing that those patients and every good patient care coordinator and director ought to have a good relationship with the chaplaincy department. So you can't tell me you have a good patient care department if you don't listen to your chaplain. And before every patient is nearing death or upon their death, who do they call in? The chaplain, who then have to negotiate the death and last responder realities for that family. What funeral home is nearby? So all of those realities, but 2 great entry points for researchers: university chaplaincies, hospital chaplaincies.
Thank you. Very helpful. Thank you. And you all do community-based work. And I wanted to see what were some pointers or things that have worked well for you with really buying trust or gaining trust with program participants as well as organizations.
Yeah, I just want to add on to what Reverend Armstrong said, because I actually was on the flip side of that for him. So there's 2 quick points. One, it wasn't simple internally for me to be able to do this. There was definitely pushback on my own team. And so the one thing that did come up was, oh, well, this is a religious organization. We believe in equality for LGBTQ individuals, so there's an inherent conflict. And I was, I then just reminded them what implicit bias means. I also said, at the end of the day, we cannot claim to do anything related to equity if we ignore religious institutions, period. We just can't do it. It's not feasible. It's not going to be possible for us to actually affect change. So that was the other piece to it. But in addition to that, it was that piece about the humility and having some respect. And one of the things that does come up is that distrust. And so one of the things that I've said is if someone does you wrong over and over and over again and you don't trust them, that's not really distrust, that's just common sense. So I think we have to frame it a little bit differently and stop talking about how, oh, we got to get, the trust this and the trust. No, you broke the trust. So now it's incumbent upon you, upon me as the researcher to engage myself, to come in with humility, to come in with respect, to stop, those biases, and for me to do whatever it takes to prove myself, not even with the hopes of gaining the trust back, that comes down the line. But we have to stop framing it as some issue of there's so much mistrust in the community. No, there's good common sense, because after, you do it once, you do it twice, you keep on, that God lets me know something ain't right. And so that's how we're supposed to be responding. That's a reasonable and appropriate response. It's not something that we need to try to overcome. That's a problem that Black people are holding on to a grudge. That's not it at all.
To answer your question and build upon that point, when we come into communities and we damage them, we are not to then tell the community how fast that they should recover. When you come into a community and you cause historic calamity, it is up to you to then seek the grace back from that community. And so to answer your question and to piggyback off my colleagues, I think representation matters. And when we often have this conversation about DEI and this attack on DEI, there's this false propaganda that's tied to it. And really, DEI truly matters. Representation matters, right? And so when it comes to building trust in communities, people want to see people who look like them coming to home visits. They want to see Black researchers, right? One of the things that I'm especially proud of is, partnering with Morehouse School of Medicine on our ATL Fathers Matter breakfast, right? I was a Black man who was helping to facilitate that. So then we had 45 Black dads there, right? It wasn't just my race, it was also the intersex of my sex, right? So being a Black man. So when it comes to what the becoming of what we're seeing in early childhood education, there has to be a rally for more Black people, but particularly Black men. And we've known this, right? Because the research is abundantly clear of the benefits, but oftentimes we are looking at Black men from a deficits-based lens or attaching stereotypes to them as if their sexuality has anything to do with them being in the field, right? And so to just break the ice on that question, I think that representation matters, and there is an attack on DEI that is important to note at this time.
I just wanted to add to your point, and that takes time. So as someone that works in government and people want something right away, I always have to say, this takes time. We don't have African-American coaches at the CCR. We don't have Somali coaches. We don't have Russian-speaking folks. And so they have to exist in order for this to work. And I'm continually finding this pressure of, well, we put this tax money here. We're not doing it that way. And we said in the plan, we're not doing it that way. And we're still recovering from COVID. And so 20% of our programs have closed. And so we're trying to fix that and then build the infrastructure around them for the TA that looks like them, that speaks their language, that gets family childcare, that not coming from a lens that looks very different than their lived experience. And so this takes time. And the pressure that a funder can give to that can make you do the wrong thing and go back to that mistrust again. And so I just always want to say, take your time and speak truth to power, because if not, we're not going to get where we're trying to go.
Any questions? Yes.
So So thank you so much. This is so wonderful. It was a full word, all of the presentations. So I have two questions. I feel like before maybe the choir comes up because it feels like they're on their way, right? So I have a question about the way in which you use this program. It felt like it was built, this program was built, and then you use policy and then research to really make racial equity the focus. What role does policy play in bringing this research together so that the equity is intentional and it's not an outcome, but more of an action?
Well, I'm going to let her speak because it's her expertise, but I would say it is my understanding that equity was always at the center of it.
Right.
They didn't, like I said, I wouldn't have kept that conversation going with that person if I didn't believe that it was really something that was grounded in equity, but I'll let her tell the story.
Right. So when I talked about the Parent Accountability Council, they said that this is what we want. We want our babies to be supported, and we know that you're going to have to invite all kinds of people that haven't worked with our babies, and how do we make sure they're safe? And so they were a part of that. And so how are we going to make sure that takes place? And so we're going to be in the programs, we're going to give coaching, we're going to have these hard conversations when we see an interaction with a teacher and child, and there's a same interaction with a Black child, and it's a very different response that teacher gives. And so in relationship with coaching, we're gonna be able to say, this is what we saw. Let's talk about that. But we spent time to build relationship first with the coach in that program. So I think they hold us accountable to that. And they ask, so what does that look like? We know it's new. How are you really holding your system accountable for this? Because we don't want our children harmed. These things cause harm, right? And so 3 and 4-year-olds being expelled or their parent being ignored or not greeted when they come into the door, and so the parent doesn't want to come. So all of that is the feedback we're giving the programs and helping them to really adjust their practice, right? So that those children are affirmed.
Served under two governors on their governor's task force for children. And so Governor Jim McGreevey, Governor John Corzine. And what I learned in my state government experience, whether appointed or elected, is government often reacts quickest to those with the loudest voice and longest money. And the funders become important in this conversation, because if funders are giving money to partner in public-private partnerships with government, then the government is listening to the ethics of the funder. And if you can influence the ethics of the funder, you don't have to be in government to do that. And so I want to give a shout out to Allison, and I have great respect for Systems for Action, Robert Wood Johnson, who has funded our project and has funded many other projects. I think they're one of the funders of the NAACFRC Center. But Robert Wood Johnson, great source. I know their ethics. Not only are they headquartered in New Jersey, but I have an opportunity to influence the board and others who shape their funding strategies and trajectories, and ensuring that equity and diversity is at the heart of that. I know Lily's ethics. I know Pew's ethics. I know Templeton's ethics. These are some of the biggest funders in the Christian public theology, public-private space. And so I'm not just going to look at the government to set the ethical standard. I'm looking at the funders. And then if where the government is, I then knock on the governor's door and say, I demand this to be a part of your budget, because budget is a religious statement of your values. And so I want to ensure that ethics and my ethics are infused both at the funding level and at the government policy level.
Just one more question, very briefly. Yes.
We started to lead into it. Hi, I'm Dr. Dougleen Jackson from Florida. And I would like to ask your thoughts and recommendations as to continuing this work in a climate where DEI is under such attack. Thank you.
We'll probably just have one person respond.
Oh, okay. Okay, I'm just gonna be real. So before DEI, there were Black people, there were brown people. We have always done it, whether we had to, send a message in a hairstyle, or, way back when, beat a drum to communicate with a whole other village. So I think the word to end with today is the way that we created DEI will create something else. Will we've done it. We've gone from, Negro to Black to African American to what we have, and we have it within us. And I think it's what our keynote speaker started with today. And talking about that history and the scientific mind and the research and the creativity and the imagination that we all have, we will reimagine it again. We will continue because we always have. That is what is innate within us. That is the gift that God has given, our people in particular. When you look at that historical context, there is always that ebb and flow. If it was the Civil War, then I mean, you think about that, somebody hit the go button because we became senators and all kinds of stuff overnight, establishing, institutions of higher education. Somebody just hit a go button and said, oh, okay. And then what they do, Reconstruction came along. So then they came out with something else, right? Then we get into Jim Crow, but guess what else we did? And guess what we did again? And guess what we will do? So they may have a problem with DEI. Okay, I'm still here. You can't get rid of us. We talk about America. We are the fabric of America. Democracy is online. No, we are democracy, right? We are the ones who hold everything to a standard. So yes, DEI is under attack. We have to be aware, but we'll tap into it and we will do what we have always done, and we will always come out ahead, and we will continue to be the leaders that we have always been. So that's
That's a
my
perfect place to
perspective.
end this session
Yeah.
on. So thank you all so much. Mic drop for sure. Thank you all so much for being such a wonderful panel, as well as presenters and participating in our conference. It was of such great value. Thank you.